When patients are diagnosed with metastatic breast cancer, they can experience a wide range of feelings, anything from sadness, which is the most common, to anger, to disbelief. I tell my patients that these feelings that they're experiencing are completely understandable. When you hear this word and you're going through this diagnosis, it's very hard to cope, and everybody copes with these emotions differently. So most importantly, I tell them to choose who their doctor is going to be, and it has to be somebody who they're comfortable with and trust. So things to prepare yourself to ask before you go into your doctor's office are things like, what is my stage? What is my diagnosis? What is my subtype of breast cancer? Because not all breast cancers are the same. Every treatment we use for metastatic breast cancer has a different set of side effects, and understanding what those side effects are so that they can better be prepared at home once they start treatment is extremely important. Other questions to ask are what my prognosis may be, which oftentimes is very hard to predict, but it's an important question to talk to your doctor about. The other questions to ask them is what my care team may look like, because there's a large care team when it comes to taking care of you. So often your care team will be composed of different people. It will include several different doctors, a medical oncologist, a surgeon, and a radiation doctor. It may also include a physician assistant or a nurse practitioner or a nurse who work closely with your doctor, your social worker, a nutritionist, and a chaplain. It's also extremely important to be organized, to have copies of your records, your pathology reports, your laboratory values, and any imaging that you may have, so that when you are speaking to doctors, you have this information with you. Write your questions down, because as soon as you walk into that office, you may think that you have your questions in your head, but you may forget a lot of those questions. Another way to be prepared for your appointment is to speak with a trusted family member or friend who you may want to bring along with you. Having an extra set of ears with you can be extremely helpful. It's also important to know that even after you go home, it's okay to call the doctor if you do forget to ask a question or something else comes up. Having metastatic breast cancer is a part of your life, but it is important to not let it become your life. I tell my patients that many of them are still able to work and they work full-time jobs. I tell them that it's still important to do the things that they love and enjoy every day to the fullest, because that's the most important thing in the world, no matter what your diagnosis is, even if you don't have cancer.